Good morning and welcome to our Primary Care Information Project Provider Recognition Day. I'm Tom Farley, New York City Health Commissioner, and I want to thank you for coming, and even more so, I want to thank you for providing great care to your patients. We're here to celebrate your success through the use of health information technology in preventing disease and saving lives. 8 years ago, the people on this slide had a simple idea. Let's use the latest in information technology to give doctors the tools they need to better prevent disease. Now, that's easy to say, but it was difficult to realize. Making it work required involvement of the highest levels of government. In public health, it involved the private sector, and of course, it involved providers. And it took all the people on this slide, including Mayor Bloomberg, that you can see there, Dr. Tom Frieden, who was then the Commissioner of Health for New York City, Dr. Richard Daines, behind him, who was the New York State Health Commissioner, Dr. Farzad Mostashari, who was our PCIP director, Girish Navani, who is the CEO of eClinicalWorks, the health information technology that was used, and Dr. Samir Segal, who is the provider here, who leads Essen Medical in the Bronx. Now, in 2008, this team succeeded and rolled out a prevention-oriented electronic health record, which had public health functions that was designed by the team. The hope then was that this tool, with this tool, we would see measurable improvements in the quality of care, specifically around clinical preventive services. And now to talk about what has happened since 2008, I want to welcome Mayor Bloomberg.
Well, good morning, everyone. You probably wonder why I picked Farley to follow Frieden. It was an economic move. We didn't want to have to change the initials on the towels in the health department. Being with so many doctors reminded me of a story when I was thinking about what to say. There's this woman who says to her doctor, "Doctor, I hurt all over. I don't know what it is." And the doctor said, "Well, what do you mean? What hurts?" She touches her knee and she says, "Ouch." Then she touches her cheek and she says, "Ouch," even louder. And finally she touches her shoulder and she screams. The doctor says, "I know what's wrong with you. You have a broken finger." Look, guys, it's not easy to come up with humor about doctors. You know why we don't tell doctor jokes? Because the doctors don't think they're jokes and the public doesn't think the doctors don't like the jokes and the public doesn't think they're jokes. Anyways, good prescriptive doctors like the one this woman apparently had are a big reason why New Yorkers are living longer, healthier lives than ever before. Part of being a good doctor is having the tools you need to provide quality care. And just as important, it is that patients have the information and the resources they need to make better choices about how to stay healthy. You know, we basically control our own future, and that's certainly true with health in most cases. Our administration has long focused, as you know, on improving health care in New York by empowering our health care providers at every level, as well as their patients. We've focused on expanding the use of preventive care as well as improving care in our hospitals and clinics to tackle some of the biggest health problems. The ones that we really focus on are cancer and heart and respiratory diseases, diabetes, and high blood pressure. And that approach has paid big dividends. We've also focused on some public health issues like smoking and murders and traffic deaths and deaths by fire. That you really can make a difference. This year, we have to really focus on obesity. For the first time in the history of the world, more people will die from the effect of too much food than from starvation. Just think about that. And it's all happened in the last 20 years or so. In our city, I'm happy to say we have had some results. We have the lowest murder rate we've ever had, lowest deaths by fire, lowest number of people dying from smoking, lowest number of traffic deaths we've ever had. And since 2001, I'm happy to say life expectancy in our city has increased by a full 3 years. Now, life expectancy in the nation as a whole has gone up during that time as well. But generally, you are going to live a lot longer if you live in New York City than if you live in the rest of the country. So if you have friends and relatives, people you care about deeply that live elsewhere, And we'd like to improve or increase our tax base, too, so everybody's going to be happy. Less than two-thirds of the improvement we've enjoyed here is what the rest of the country has had. So we've got to be doing something right, and even though we've already outpaced the nation in improving health outcomes, we know that we can do even better. Increasing access to healthcare technology is a big ways that we'll be able to do that, and that's why today's event really is so important. The effort that you've all helped our administration pioneer, developing and expanding the use of electronic health records, has improved not just the length of New Yorkers' lives, but also the quality of the lives as well. And the new data that we're releasing today really does show that. Before we go into the data, though, let's discuss just how important electronic health records have been. In 2005, under the leadership of then Health Commissioner Tom Frieden, our administration has started a revolution in how doctors across our city provide care. The key was not just computerizing medical records for their patients, but transforming how doctors use those computerized records to improve care. We've always said if you can't measure it, you can't fix it, but it's also true that if you just have the data and don't look at it and use it in your decision making, you've just wasted an awful lot of money. We've invested $27 million to help doctors serve low-income patients, and I don't think we wasted this money. We've worked very hard to make the transition to electronic records as painless as possible, and we've been providing ongoing technical support after it got going. And today, thanks to the leadership of Tom Farley, our primary care information project is one of the largest community-based networks of electronic health records in the nation. And it's helping more than 3,200 primary care doctors deliver better, safer, more effective primary care to more than 3 million patients in the neighborhoods that need it the most, including in East and Central Harlem, the South Bronx, and Central Brooklyn, where the chronic conditions I described, like diabetes, are alarmingly common. And I want to thank all of the healthcare providers here today for helping us reach this important milestone. Now, as you've no doubt seen firsthand, electronic health records, or EHRs as we call them, improve primary care in a number of important ways. They're an interactive technology that automatically uploads a patient's lab results, as well as information on what diseases and conditions are most common in the patient's community, and that provides both patient and doctor with the vital information that they need when and where it can do the most good. And because the health department can track the prevalence of particular diseases and disorders at the community level, we can target interventions where they are needed most. EHRs also bring an end to the days of lost records, and they can make records accessible even in the event of disasters like Hurricane Sandy. And perhaps most importantly, EHRs are helping doctors save thousands more lives by improving preventive care. Every year, hundreds of thousands of people needlessly die from heart disease, stroke, cancer, and infections. And we can stop many of those tragedies with EHRs. The prompts that doctors get from electronic health records make a dramatic difference in how aggressively they treat the chronic health conditions of their patients using simple, low-cost preventive methods. And some methods include, such methods include reminding patients to take daily aspirin, which I do incidentally. That helps prevent heart disease, or providing blood sugar screening tests to detect diabetes. EHRs also permit doctors to view data on the entire population of their patients, which helps them modify their routine office practices to help all of their patients and then evaluate how well those changes work, and also to make the doctors more efficient. If we are going to have the kind of medical care that Washington keeps promising us, we're going to have to make doctors a lot more efficient simply because there just aren't enough doctors. We have about 500 people per doctor in America, and one of the things my foundation's working on is maternal care in Tanzania, where they have 50,000 people per doctor. And that's an enormous challenge, but we are finding ways to actually do something about that, and we've got to do the same thing here. Most importantly, though, EHRs empower doctors not just to treat illnesses, but to do what we all would like to do, prevent them. The new data we're releasing today shows that between 2008 and 2011, the number of preventive care services participating doctors provided grew on average by about 190%, from 39 services per 100 patients to 113 services per 100 patients. That's nearly a threefold increase. And if you think about the number of New Yorkers that figure represents, it really does make a big difference. With the help of electronic health records, an additional 81,000 patients improved their management of diabetes. Some 96,000 New Yorkers got help in controlling their high blood pressure. An additional 58,000 smokers got help in kicking the habit. And these preventive measures have undoubtedly saved thousands of lives and improved the quality of many thousands more New Yorkers' lives. Now, fortunately, such improved care isn't limited to New York communities. Since Dr. Frieden and Dr. Farzad Mostashari pioneered the use of electronic health records in our city, they've helped doctors across the country adopt this transformative technology as part of the Obama administration's Affordable Care Act. I don't think we appreciate here in New York just how important what we do is to the rest of the country and the world. And I would just ask you to think about what happened with smoking. California banned smoking in public places, and nobody paid any attention. New York City did it, and I did get a call from one of the governors in an adjoining state saying, thank you so much, because everybody from your city is going to come to my state to have dinner and drink and spend money. Literally a couple months later, the governor called and said that the governor was introducing legislation to ban smoking, and I said, why? And the governor said because his or her son had not spent a night in their state since we banned smoking. And today, all of Western Europe, a very big chunk of Latin America, you're starting to see it in Asia. If we do it here, we really do have a big impact. So by us helping ourselves, we're also helping the rest of the world. And we've helped doctors across this country again and again, and not just with this. We're very proud of the fact that just as we provided a national model for electronic health records, we've also been a leader in curbing smoking, I just talked about, and in introducing calorie counts. We put calorie counts in restaurants here, and lo and behold, in the latest federal legislation, they appeared. I don't know who put them in, but whoever did was really helping us. We've pioneered the use of alternatives to trans fats, and we're now working on obesity. And hopefully the courts won't stop us, but if we can use portion control with full sugar drinks to just sort of tweak people and give them the information they know and get them to drink a little bit less, then we will make a big difference on obesity. And also, we've pioneered something else, and that is these grades for restaurants in this city. Once we put the grades in, the cases of salmonella reported at our hospitals plunged 20% almost overnight. So these small public health things that we do really do make a difference in people's lives. We can do more, and that's what we've got to keep doing. As part of the federal stimulus program, our health department received additional funding that allowed us to continue expanding the use of EHRs, and we've begun working with behavioral health scientists and with high numbers of Medicaid patients to adopt and implement EHRs so that these patients can get better care. And I want to thank all of you for your commitment to ensuring that every New Yorker, regardless of income, has access to the best health care possible. We really can make a difference if we work together. All of these things, the papers make fun of it, but if you go out and ask the public now, there is literally not one person in this city that was not with us when we wanted to ban smoking. I don't remember anybody making a fuss about smoking. The papers didn't. Everybody was with us. And if you want to have evidence of that, don't read the newspapers anymore. Let me now welcome Health Commissioner Farley back to the podium. He's going to tell us more about working together to achieve these goals. So thank you very much, everybody.
Thank you. Mayor Bloomberg talked about the thousands of additional people who are getting preventive services as a result of the now 3,200 providers who are in the PCIP project. And this chart shows that increase, and that's based on quality reports coming from your offices. And let me just walk you through this a little bit. So the percent of patients who are getting recommendations for aspirin therapy increased from 58% in 2009 here on the left to 75% up there in 2011. The percent of people with hypertension who are getting their blood pressure controlled increased from 55% to 64%. The percent of patients who are with diabetes who are getting a hemoglobin A1C test, that's the green line, increased from 46% to 58%. And we saw huge increases in the percentage of smokers who are getting counseling or medications to quit from 29% up to 46%. Now, let me just point out the importance of these percentage increases. The population base for these numbers is 3 million patients. And we only have about 6 million New Yorkers across the city of New York. So this is a population-level increase in the use of services that we know save lives. Now, you also make this connection between the use of these preventive services and saving lives. Back in 2007, Drs. Frieden and Dr. Mostashari asked another question, which is how many lives do we save if we use those more preventive services? And as a result of a lot of work after that question, this graph came out. What this graph does is show just projections of how many additional deaths could be prevented by increasing the use of a small number of preventive services that we know save lives. So as you can see, for example, if we increase blood pressure control from 50% to 80%, we estimate that would save about 43,000 deaths per year nationwide. And in general, those services that prevent heart disease save the most lives. Those are over here on the right. If all three services on the right were used by 80% of patients for whom they're eligible, we would save over 100,000 deaths per year annually. So here in New York City, we've shown that we can improve the preventive services, and those lives saved should follow. Now, the others around the country have used electronic health records to improve the quality of care. We are not unique in that. But we are unique in this. The other organizations that have done this tend to be single organizations where there's a command structure. For example, Kaiser Permanente, where the doctors are given protocols by a supervisory organization. What's unique about our system is that these are independent practices, often very small practices. So, and those practices, for the most part, are dealing with people who are most underserved. So, shown that if we can do this here, and we can, this model can be applied anywhere in the United States. Now, this is important. The use of electronic health records by itself doesn't cause quality improvements like this. Electronic health records are just a tool. And just as a scalpel won't perform surgery by itself, electronic health records won't do quality of care by itself. The care is only improved if you have providers who are using the data intelligently to change how they practice. So PCIP does a lot to try to help providers do that. We offer quality dashboards, which are now going to 450 practices, and we offer on-site technical assistance about how to change office practices to improve these quality preventive services. This combination, and we have over 60 staff now who are working on the quality improvement work. And this combination works. So the bottom line is this: we are transforming medical care in New York City. The smart use of electronic health records, it prevents disease, and it saves lives. Now, there are many people to thank for us getting to where we are today. PCIP has been supported by a large number of federal agencies, state agencies, and by private foundations. Some of the private foundations are in the audience today, and so I just want to call out a few that have really been central to our success here. This include the Robin Hood Foundation, the De Beaumont Foundation, Pfizer, WellPoint, Robert Wood Johnson Foundation, and the New York State Health Foundation. Now I'd like to introduce our next speaker, who's Dr. Frieden. Now, Dr. Frieden, as you know, has led the best and most prominent public health agency in the world. That is until he moved to that small health department in Georgia a few years ago. PCIP started under Dr. Frieden when he was New York City Health Commissioner under the leadership of Mayor Bloomberg. He pulled together the best people to make it succeed, including Dr. Farzad Mostashari, who is now the National Coordinator for Health Information Technology. And they turned this basic idea into reality. He's now the Director for the Centers for Disease Control, and he continues on his mission of health promotion and disease prevention across the entire nation. He's someone I consider a friend and a colleague, and more important, he's someone whose success I continue to take credit for. So now let me welcome Dr. Frieden.
Thanks very much. It's great to be back. 11 years ago, Mayor Bloomberg had his first meeting with all of the commissioners, and he gave us great management advice. We were all putting together our teams. He said, only hire people smarter than you. And I was very fortunate to be able to hire Farzad Mostashari and Tom Farley. Farzad really conceptualized this whole project, and Farzad and his team have scaled it up over the last few years. And really, it's achieving results that are far beyond what I thought would be possible when we started it. It's a model for the country, but even more importantly, there are critical lessons that we're learning from how it's working, what works and what doesn't. The bottom line is that electronic health records can save lots of lives, but only if they're done right. When we conceived of it, we had tried between about 2002 and 2005 to improve the quality of clinical default value. Now, there's a lot that we know electronic health records can do. Through the Meaningful Use Initiative, we can have better detection and response to outbreaks through laboratory reporting, which now is more than half of all the lab reports in the country. We can have better immunization rates and have doctors have access to the immunization records of their patients so that they can find out who's missing immunization and also avoid over-immunizing or duplicate immunization, saving money as well. And we can use information from emergency departments to track what's happening in the community generally. There are also some new exciting possibilities. One of the terrible things that we're facing in this country is an epidemic of opiate overdose. It's one of the few things that's gotten worse in the last few years. And electronic health records, if they're integrated into prescription drug monitoring programs, have the potential to greatly reduce that problem. We also can use electronic health records to refer patients to community resources, quit lines, or diabetes prevention programs, or parks. And in information that New York City is piloting, it is apparent that if you have a big enough standardized electronic health record system, the information that you pull anonymously from that system may match very closely the community health data that otherwise is very difficult and expensive to get. I think this is the next big thing in health, the Bloomberg in health, you might say, where you're able to get information in real time and use that information to improve programs and figure out what's working and fix it if it's not. Now, when we started implementing this program, Farzad and I were talking, and we said, all right, like, what do we do? Like, what problems should we address? Look up in the medical literature, millions of articles in the medical literature. Look up in the medical literature, how can you save the most lives in healthcare? Now, there's lots of important things to do to improve health, but as someone once said, the death rate is a fact. Everything else is an inference. So preventing premature death is pretty important. And what can we do to do the most good there? Well, it turned out there was nothing written in the medical literature about that. So the graph that Tom Farley showed earlier is what Tom and some of his colleagues put together that showed that it's cardiovascular disease, heart disease and stroke, which isn't that surprising because 2 million heart attacks and strokes per year in this country, the leading cause of death, 800,000 deaths, more than $300 billion in healthcare costs, 1 out of every $6 that we spend on healthcare, and the leading single cause of health inequalities in this country. What we see, though, is that we're not doing very well on cardiovascular prevention. So we've set a goal at the national level of preventing 1 million heart attacks and strokes in the next 5 years through community prevention, tobacco control, trans fat elimination, sodium reduction, and clinical care, particularly better control of the ABCs, aspirin, blood pressure, cholesterol, and smoking. And when we've looked around the country, we've seen remarkable success stories, not just in the Kaiser and VA programs, which are very impressive, but also in small practices if they focus and if they unleash the power of information technology. PCIP has exceeded the highest expectations. And there are, I think, 5 key lessons that we've learned from New York City's experience. The first is that even when you do it right, progress doesn't happen automatically. It takes work to get music out of the piano. You have to figure out how to use the electronic health record to really improve health. Second, although incentives matter, helping doctors do a good job matters more. Doctors went to medical school to do a great job. We stack the deck against them too often. By having electronic health records with the prevention as the default value, we make it easier for doctors to do what they want to do, which is provide great care. Third, if you want to improve a clinical practice, do it from within the clinical practice, not from outside. Whether that's the office manager or a nurse or a pharmacist or a PA or the doctor, her or himself, it has to be intrinsic to the process if you're going to have a sustainable long-term impact. Fourth, and the thing that surprised me the most from all of this, is that you actually can reach huge numbers of smokers through clinical care. I didn't think that was possible. When Mayor Bloomberg got the Smoke-Free Air Act passed or raised the tobacco tax, that affected every smoker in New York City, and we saw big declines in smoking rates. When you try to get smokers to quit individually, you have to counsel one by one by one. The Bloomberg School of Public Health has its motto, helping people millions at a time. Well, can you, through electronic health records, also help people millions at a time because you have one system that's doing it? And that's some of the very exciting numbers that you're producing here. And fifth and finally, if you give feedback monthly, you can get improvement within a year. If you give it yearly, it's going to take a decade. But the practices which have worked on their data every month and used it and fed it back to the doctors have had rapid improvements. So not only is the program achieving great results, it's achieving them by looking often, accurately, and I would even say coldly at the data and using that to improve performance. This is better information through electronic health records, and that is saving lots of lives and lots of money. Congratulations, New York City.